Yes, so we did a research project on AML survivors who were former patients from the AML CG study group studies. And we invited 909 survivors to participate in our questionnaire-based project. And around 420 responded and could be analyzed also for their parenthood status. So former patients, and now we call them survivors, answered if they have children and how old they were. So we could analyze if these children were born before or after the AML disease. And we could also associate that with other variables that we had from the clinical trials and that we could associate with the parenthood status. So we analyzed this data and found that patients who got that AML disease during their reproductive period showed an increased rate of childlessness. And that was kind of interesting. What's more striking probably about this data is that we also had a number of patients who reported to become parents after the AML disease. And we also analyzed this in more detail, but found that age at diagnosis is the major factor that influences the rate, the probability that a former patient, gets children after AML. So overall, we could show that it's this kind of research brings a lot of new information also in the survivorship phase, and that we usually probably do not have in the focus when we talk about the treatment and genetics and so on. So this kind of interesting research, and we hope to move on with that in a new project.